We're going to talk a little bit about setting up your collection containers for a paracentesis before you get too far along into actually doing the paracentesis. And the reason this is important is that, once you actually kind of get to the ascites, you want to make sure you have a plan of where it's going to go. If you're going to pull up some in a syringe and just send it off for diagnostic testing, that's fine. But if you're going to do something that's a larger volume paracentesis, you need to kind of have your collection bottles ready to go and kind of a plan for how you're going to connect the ascites in the patient to ultimately the bottle where it's going to end up. So there are a number of different types of collection bottles. This is just a vacuum container here. It's a liter bottle there, and it's under vacuum, and you have to kind of operate it when you're not scrubbed in for the most part. So you may be working with a colleague to kind of actually release it from its vacuum so it actually sucks things out. Or, what you can do is kind of what I'm trying to demonstrate here. You can kind of set up the bottle off to the side from the sterile field and kind of have it accessible to you that once you scrub in, you can kind of connect in a sterile fashion and then be good to go. So this is what I kind of want to demonstrate, is just having a plan before you scrub in. The bottle's there, the connection, all of that is not sterile for the purposes of this example, so the connection is there. I have a sterile piece of IV tubing here. This is just extension tubing. So I'm going to use the female part, which will connect to the male part there, and then I can use, let's just say, a gauze pad or something and stay sterile, and I can just grab the tip here and I can screw it on, and then we can just drop that over there, cover it with a sterile towel, and now all of this is sterile, so for the purposes of the case, I can use this without worrying about contamination. And then once I kind of connect everything here, I can scrub out and then release the vacuum and then just kind of switch the bottles as I see fit if I'd like. But this is just a very easy way to kind of set things up beforehand, have a plan, and then just kind of set it up for success here as well.